A unicompartmental knee replacement, also known as a partial knee replacement, is a surgical procedure performed to treat knee osteoarthritis that is limited to one specific area of the knee joint. Unlike total knee replacement, this procedure only replaces the damaged compartment while preserving the healthy cartilage, bone, and ligaments in other parts of your knee. The purpose of this procedure is to relieve pain and restore function to the affected area while maintaining the natural feel and movement of your knee. You will be positioned on your back during the operation. Depending on your specific needs and medical history, you will receive either general anesthesia, where you're put to sleep, or spinal anesthesia, where you're awake but numb from the waist down, to manage pain effectively. Your surgeon will make an 8 to 12-inch deep incision at the front of your knee, usually smaller than what will be necessary for a total knee replacement and sufficient to identify arthritis or other issues. First, they will inspect all three compartments of your knee: the medial compartment, inside part, the lateral compartment, outside part, and the patellofemoral compartment, the front part between the kneecap and thigh bone, to confirm that the damage is indeed limited to one area and that your ligaments remain intact. This procedure will involve three main steps. Step 1: bone preparation. Your surgeon will use specialized surgical saws to carefully remove the damaged cartilage and bone from the affected compartment. Step 2: implant positioning. The surgeon will measure your bone size and position metal components that recreate the natural surface of your joint. These metal parts are typically secured to the bone using bone cement, though in some cases, a cementless technique may be used where the implant is press-fit to allow your bone to grow onto it. Step 3: spacer insertion. A plastic insert is placed between the two metal components to create a smooth gliding surface that mimics your natural knee movement. A unicompartmental knee replacement typically takes between 1 or 2 hours to complete. After surgery, you will spend time in the recovery room where you will be monitored as you wake up from anesthesia. Most patients go home the same day or after an overnight hospital stay, depending on the progress of their recovery. You will begin putting weight on your knee immediately after surgery. However, you may need to use a walker, cane, or crutches for the first several days or weeks until you feel comfortable walking without assistance. Recovery guidelines include pain management. You will receive medication to control postoperative pain, which may include prescription pain relievers, anti-inflammatory medications, or local anesthetics. Your medical team will work with you to find the most effective pain management approach. Physical therapy. A physical therapist will provide you with specific exercises to maintain your range of motion and restore strength to your knee and surrounding muscles. Gradual activity increase. You can typically resume most regular daily activities by 6 weeks after surgery. Follow-up appointments. Regular checkups with your orthopedic surgeon will monitor your healing process and address any concerns. The recovery from partial knee replacement is generally faster and less painful than total knee replacement, with many patients experiencing less swelling and a quicker return to normal activities. Unicompartmental knee replacement is generally considered a safe procedure with excellent outcomes. However, as with any surgery, there are potential risks and complications to be aware of. Common risks include blood clots, infection, nerve or blood vessel injury, continued pain, implant-related complications, and anesthesia risks. It's important to contact your surgeon immediately if you experience fever, severe pain, unusual swelling, numbness, or any signs of infection, such as drainage from the incision site. Additionally, it is important to consider that if arthritis is identified in additional compartments of the knee during surgery, the surgeon may need to make an immediate intraoperative decision to proceed with a total knee replacement instead of the initially planned procedure. This decision is based on what the surgeon observes during surgery. While preoperative imaging provides valuable insights, it may not always reveal the full extent of joint damage. If the surgeon determines that other compartments of the knee are significantly affected, proceeding with a total knee replacement may offer long-term function, pain relief, and overall joint stability compared to a partial approach.